Guys, we're giving you more 5 minutes. Then we'll be starting with the quiz. For 2 minutes to go, guys. We'll be starting the quiz exactly at 10:15. Last minute to go. Let's get started.
Yeah,
Alright. So, guys, welcome to another exciting episode of JuxtaMed Quiz. Today, we are diving into ophthalmology, a subject where a keen eye for details can make all the difference. Some of these cases might remind you of classic textbook findings, while others will test your clinical reasoning. So, are you ready? Right. So,
yeah,
let's
let's begin.
your first question. A 60-year-old hypertensive male presents with painless progressive peripheral vision loss over several years. Fundoscopy reveals optic disc cupping and tonometry shows a intraocular pressure of 28 mmHg. Visual field testing confirms accurate scotomas. What is the most likely diagnosis?
So, guys, this is the silent thief of sight because it often remains undiagnosed until significant vision loss is seen.
Right. So, primary open angle glaucoma is the right answer. Let's see the leaderboard. So, guys, okay, let's keep up the pace. You're doing great. This is your first question. 19 more to go.
Okay, 28-year-old male presents with painful red eye, blurred vision for 3 days. On examination, there is circumcorneal congestion, miosis and posterior syndicate. Slit lamp examination shows cell and flare in anterior chamber. Which of the following is most commonly associated?
The clue is this eye condition is commonly associated with HLA-B12. Right.
Right, it's ankylosing spondylitis. Yes.
So, you can understand that it is a systemic involvement. Let's keep going. A 55-year-old diabetic patient presents with sudden painless loss of vision in his right eye. Fundoscopy reveals a cherry red spot at the macula and pale retina. Which of the following is the most likely underlying cause?
So here, retinal arteries play a crucial role here. Uh, so what happens when they get blocked?
That's what we are asking you.
Yeah.
All right, so you got the right answer. That is central retinal artery occlusion. Moving on.
Okay, a 65-year-old male with history of long-term corticosteroid use presents with gradual painless blurring of vision in both eyes. Slit lamp exam reveals opacification in posterior subcapsular region of the lens. So which of the following type of cataract is most likely seen here?
Right, so most of you have got this answer right. Posterior subscapular cataract is the right
I
answer.
think
Yeah.
I think we gave the answer in the question. Our bad.
How come?
No, I think I've missed the. We have given opacification posterior subcapsular regions.
Hmm. Ah, okay,
I
okay.
think we were confused. I think it's okay.
So we got Myra leading the leaderboard with the longest streak, followed by Krishna, Darshini, F, Shri Rama, Shri Raj, Dr. Max, RK, Navi, Sureen, S, Thor, Komal, Faith, CK, PP, C, PKSM, BDSM, I think. Baluram, Naga, Hemant, Suju, Ashish. Guys, you're doing great. Every one of you. So let's just click on the answers that you think it is right. And remember, there are no negative marking. So let's go. All right. A 25-year-old male presents with pain, photophobia, and blurred vision in his right eye for the past 2 days. Slit lamp examination reveals dendrite ulcers with fluorescein staining. Which of the following is the most appropriate treatment?
So if you recall your viral infection, this is the most common infection. Easy.
Nice. So Acrovir is the right answer, and it is the most appropriate treatment as well. Guys, tell us the diagnosis. Let us know the diagnosis till we see the leaderboard. All right, so not much changes. Great. So read the question.
A 30-year-old male presents to ER after being hit in the eye with a cricket ball. He complains of sudden painful vision loss. Examination reveals 360-degree subconjunctival hemorrhage and peaked pupil and a positive radial test. What is the most likely diagnosis? So here fluorescein dye leakage confirms the diagnosis. So it will be a globe rupture.
All right, guys. Right, so tables up turned. Sri Rama is leading up the leaderboard. Yeah, and then Myra, Krishna, F, S, Sri Raj. All right, moving on to your seventh question. A 32-year-old female presents with sudden painful vision loss in her right eye for the past 2 days. She reports pain on eye movement and washed out appearance of colors. Relative afferent REPD is positive, fundoscopy is normal. What is your likely diagnosis?
So think of demyelination. This is often a early sign of a disease that affects both the eyes and the central nervous system.
Right.
Yeah, it is optic neuritis.
Remember, guys, it's not over until it's over. Let's keep the pace up.
A 60-year-old female presents to ER with sudden onset severe eye pain, headache, nausea, and decreased vision in her right eye. Examination reveals conjunctival congestion, mid-dilated fixed pupil, and a hazy cornea. IOP is 50. Which of the following is the first line treatment?
Hmm. What do you think was a diagnosis?
It is clear, I think. No clue is required. Yeah, it is IV mannitol.
Moving on. Right, so not much changes. Let's keep the pace. A 45-year-old male with high myopia presents with complaints of sudden onset of floaters, flashes of light, and a curtain-like shadow over his visual field in the right eye. Examination reveals a detached retina on fundoscopy, which of the following is the most likely type of retinal detachment?
So in this type of detachment, a break in the retina is a key factor.
Hmm.
Right. Like metagenous, it is one of the most common detachment.
All right, guys, let's keep the pace. We're mid of the grand finale now.
Okay, a patient presents with painless progressive vision loss and difficulty seeing at night. The given fundus image shows bone specular pigmentation. Okay, this is the clue. Arteriolar attenuation and the pale optic dusk. Which of the following is the most likely diagnosis?
Hmm.
So we have given a finding also, finding name as well.
Wonderfully done, guys. Most, certainly most, every one of you have answered the right thing. Let's move on. All right, so you guys are doing great. Let's keep the pace up. A 28-year-old male contact lens contact lens wearer presents with severe eye pain, redness, photophobia, and blurred vision in the right eye for 10 days. He reports using tap water to clean his lens. The given slit lamp image shows a ring-shaped stromal infiltrate. What is the most likely diagnosis?
This you should know. I think this was
Yeah,
a PYQ as well.
yeah, that is true.
I think in the recent year, this year, I think they asked, right?
Yeah, this year only.
Hmm.
All
Right.
right, guys. Oh yeah, acanthamoeba keratitis is the right answer. Let's move on. All right, so we got Myra, Shrira, Srirama, RK. Then we have Krishna, Navy, Dr. Max, F, Dave, Heman, S. So, alright, guys, it's a great pace. Let's keep moving only forward.
Okay, 25-year-old male presents for an eye checkup. A retinoscopy is performed at 1 meter distance. The examiner observes a width movement reflex in both eyes. So the retinoscopy findings suggest which of the following condition?
I think this also, these guys should know. This is like another new
Hmm.
great question.
Yeah.
Yeah, late. Guys, this
Confusing topic.
I know it's confusing, but then this is what is the scoring topic as well. Myopia, heteromyopia, astigmatism. These are like, I know confusing, but then
Hmm.
come on. You got to know this now by heart. It was in our 10th, sorry, 10th, I guess, or 12th. I don't remember much. In
God
that also.
knows. You're tired of MBBS doing 6 years.
Yeah, dude. So you gotta know this, guys. You gotta know this one. Please don't lose marks on silly, silly questions. All right. So we have Myra on top now, followed by Krishna, Sriraj, Nevi, Dave, Srirama. All right, guys. You're doing great. Let's keep the pace. And remember, it's not over until it's over. Okay. A patient with blurry distance vision is prescribed the following lens as shown in the image. I think you've missed the image.
Yeah, I think there is a mirror.
Hmm.
Image has been.
Disorder. Alright,
Yeah.
guys. So, image over here is something like this. The edges of the lens appear thicker than the center. Which of the following condition is this lens used in? Alright. My yes, right answer. Okay, well let go of this question, yeah.
Yeah, but the clue is there. I think they can answer this. The edges of the lens appear thicker than the center.
That is true.
That is enough, I guess.
It is. Alright, guys. I hope this is enough for you also. In case this is enough. Not much changes. Moving on.
25-year-old male applying for a pilot license undergoes a color vision test. The examiner uses a lantern test where the patient is asked to identify a pair of red, green, and white lights. The patient struggles to differentiate between red and green signal. So, what is the likely diagnosis?
Not giving you any clue. This is hard के answer me. Uno, dos, tres.
Most of them given deuteranopia.
Hmm. Okay, okay. So I think it wasn't a new late question. See, I think the terms,
No.
guys, it's only the terminology. Maybe you'll get confused, maybe you'll not. But एक बार go through it, you'll get it. So your next question is: a 65-year-old male presents with gradual painless vision loss in both eyes. Slit lamp examination reveals the following spook-like opacities in the lens. Which of the following is the most likely diagnosis?
So, this is often linked to aging, cataract linked with aging.
Let's see if you get it, guys. Come on. Cortical cataract is the right answer. Moving on.
Not much changes. We have the same players.
Right. They're maintaining it also.
Mm.
But
Okay, which of the following structure provide the majority of refractive power?
we are asking you the basics. Let's see how do you get it. Do you, I think you get it.
Yeah, it's cornea.
Right. All right. So let's keep moving. Let's keep up the pace, guys. We're reaching to the end. Okay, a 20-year-old male presents with tremors, dysarthria, and personality changes. Slit lamp examination reveals the following golden brown deposits at the corner periphery. What is the most likely diagnosis? Another very big don't you dare,
Yeah,
don't.
commonly asked.
It's like it's a favorite topic, dude. You've got to know
Mm.
this. Alright, guys, to the people who have got this wrong, please look at this image. Can you see periphery? There's a golden brown deposit. It's like a circle. That is your copper deposits, and that is your Wilson disease. Please don't forget this. This is actually a PYQ, a PYQ, PYT also. They've asked you Wilson disease 10,000 times. So don't mess it up. All right, so you guys are doing great. I can see maintaining and going up as well. So let's keep moving forward. You're doing great, guys. You're doing great.
6-month-old infant is brought to Opthal clinic with excessive tearing, photophobia, and a large cloudy cornea in both eyes. So examination reveals enlarged cornea with increased intraocular pressure. So what is the diagnosis here?
I think two options they might get
Hmm.
thinking over, but it's only one.
But one of them has some other classic sign, right?
Hmm. That could be a differentiating.
Yeah,
Nice.
they got it.
Good. Moving on. So now everyone is maintaining their positions. It's a great going. All right, so a 12-year-old child presents with eye irritation, foreign body sensation, and recurrent conjunctivitis. What is the most likely diagnosis?
So see the image, we'll get the answer.
You asked me such baby questions. Guys, this is like the extra scoring point question. Say answer.
There's an extra layer of eyelashes.
Hmm. All right. Diastasis is the right answer. Now F is rocking, apparently. All right. So let's keep moving forward, guys. We're doing great. Tonight's last question.
Okay, a 50-year-old female presents with dry eye, foreign body sensation, difficulty in tearing. A test is performed and filter paper is shown here. And it is only 3 mm in 5 minutes. Which of the following is most likely diagnosis?
I want to know if these guys also have, like, got to perform this test.
Hmm.
You must be knowing this is an autoimmune condition, affects both the eyes and the salivary gland.
Yeah.
Perfect. All right. So Sjogren syndrome is the right answer. Now moving on. Let's see what's up. Hmm.
Okay, we have Myra again as the winner.
Myra is just all ready to go. She's like, I'm gonna nail every quiz. Guys, we gotta have like spirit like Myra. Nail the quiz. So
Yeah.
congratulations, Dr. Myra.
So congrats and congrats to Sriraj, FRK, and Krishna, Navi, Dr. Max, Srirama, Dev, Hemant. Okay.
CCKS, Komal, Naga. We're calling out all of you guys because you're doing great and you've done great. So that is like the
Yeah.
all green, and this is all for you. All right, guys. So congratulations, Dr. Myra. You've been great. You've been nailing the quiz, as we can say. And I think That's all right, guys.
That's it for Opthal today.
We're thinking to let us know your feedback. Please let us know your feedback. How did you find the quiz and how is it going and everything? We would like to hear that. Yeah. Do come in tomorrow at exactly the same time, 10 p.m. We'll be there. We'll be starting with PSM tomorrow. All right. So, good night and congrats to everyone for being consistent. Good night.